So now we'll go to the criteria. So now we know that anybody young patient, less than 45 years old, comes with a chronic back pain, because that is the entry criteria. Chronic inflammatory back pain. Now you know what are the SpA features. So now come to the criteria. What is the criteria? There are two arms. That either you have to take the help of a radiology, X-ray or this thing, or HLA-B27. But first, HLA-B27, the problem is, this can be seen in 6% of the population. So false positive, even if somebody is HLA-B27 positive, they may not develop this disease. So the HLA-B27 is not a very sacrosanct test. It's not a very helpful test. So more that's why cleverly what they have told is, if you have done a MRI or X-ray and if you have demonstrated sacroiliitis, you are not far away, you only require one or more SpA features. Okay? So if you have an objective sign of sacroiliitis by X-ray or MRI, then most of the 90% of your job is done. Any one other feature, even chronic back pain, with this, that is spondyloarthritis. Right? But suppose you are not finding the X-ray and MRI are negative, then you have HLA, still you have inflammatory back pain. This is a young patient. Then you have to take the help of HLA-B27, right? But you have to take that with caution. You have to have more evidences. That's why they told if you have HLA-B27 positive, only one SpA feature will not help. You should have at least two. So more than equal to two SpA features with B27 positive. I getting it or going over it? Okay. So that is how the criteria has been done. So I can show you, this is the imaging arm. So either you have sacroiliitis, either by X-ray or MRI. If the X-ray is positive, we call this as radiography, again radiographic sacroiliitis, right? So this is called as radiographic axial SpA, which is your ankylosing spondylitis, because this will fulfill the ankylosing spondylitis criteria now. You have clinical picture, you have radiographic picture, X-ray is positive. So this is what is axial spondyloarthritis. Radiographic axial SpA or ankylosing spondylitis. If the MRI is positive, still one SpA feature is, but that will be non-radiographic axial SpA. If both are negative, HLA-B27 is positive, plus two SpA feature, that is also non-radiographic SpA. So non-radiographic SpA means X-ray is negative. Either MRI is positive or HLA-B27 is positive. Radiographic means X-ray is positive. Clear? So axial SpA is divided into two. Radiographic means X-ray is already shown, means this is advanced disease, this is ankylosing spondylitis. X-ray is negative, either you are diagnosing with MRI or HLA-B27, that is non-radiographic axial SpA.